A lot of people think that if you become a family nurse practitioner that you automatically have to work in primary care. And I'm here to tell you that that is not true. Coming from a family nurse practitioner who has been an FNP for the last 5 years and has never worked primary care a day in her career. The same way people be telling nursing students when they get out of school and pass their boards that they have to work med-surg first, it ain't true, boo. I have always worked in specialties. I have worked in general surgery, thoracic surgery, also pre-anesthesia testing, and now gastroenterology. So today, this video, we are going to talk about why I chose the FNP route, give you some background on the specialty positions that I have held and what I did in those, and then also how you can break into specialties if you're a nurse practitioner or a nurse practitioner student who will be graduating soon. Hey y'all, and welcome. My name is Brianna. I am a nurse practitioner. If you're new here, welcome. If you have been rocking with me, thanks for coming back. As I said earlier, I'm a family nurse practitioner. I currently work in gastroenterology, and on this channel, we talk about a lot of things. I share my life as a nurse practitioner, my lifestyle content, fashion, books, fragrance, balancing mom life, wife life, all of the things. So if you love those things, I'm going to say, come on and join the people. This is where you need to be. Hit that like and subscribe button and stay tuned for more videos. So today we are going to touch on just a question that I'm always asked a lot, which is, if you are a family nurse practitioner, do you only have to work primary care? Again, as I stated in the intro, the answer is absolutely not, okay? So the reason why I chose to do family nurse practitioner is because I wanted to have some balance. I feel like that it was the only way for me to not be put into a box of what I wanted to do. And that's no slight to nobody else. If you specialize down, good for you. That probably means that you thought about what you wanted to do, what your experience comes in, and then also just where do you fit? Where are you comfortable at? What do you want to do for the rest of however? And just because you specialty down, don't mean that you can't get a certificate or certification, to work somewhere else. We have options, and I just want y'all to know firsthand that we have options. So one of the biggest takeaways for me is that going the FNP route really gave me a lot of flexibility. I have just experience in a lot of places. I have worked cardiac, I have worked med-surg, I've worked trauma, I've worked pre-op, PACU, and pediatrics. I've literally worked life to death. And so it was kind of hard for me to nail down exactly what I wanted to do. So because of that, I just wanted to have some flexibility. I knew early on that I might have wanted to do surgery. Maybe I want to work in the plastics office, etc. And so I just kind of felt like I could hone in on my skills and use my experience as a nurse to catapult me into specialties, which is exactly what I did. So you may be asking, where can family nurse practitioners work? I'm so glad you asked. So of course, primary care is the first thing that people connect to being a family nurse practitioner. Outside of that, they can work in urgent care clinics. They can work in the specialty clinics. They can do telehealth. I do telehealth, gastroenterology. They can also work in some surgical settings. I think it's depending on maybe the certifications that they got, the training that they got maybe on a job, all of those kinds of things. So again, flexibility. So let's talk about my first NP job. So my first NP job was in general and thoracic surgery, which to me wasn't a huge learning curve because I was already working with the surgeons in pre-op at the time, which is how I was able to transition from being a nurse in pre-op and PACU to being a nurse practitioner in general and thoracic surgery. Of course, there's a lot of things that you have to learn, the things that is general surgery. They pretty much see everything under the sun, right? This is also with pediatrics, so this is not with adults. So I had to expand my knowledge because we are already doing pediatrics, but then you have to tack on surgery as another thing. So part of my job and what I did was, one, I did clinic with the surgeons. So we would go and see the patients first, and then the surgeon would come in, make their assessment, we figure out a care plan, and we would write the notes. Sometimes the surgeons wrote their own notes, we wrote the notes for them. So we would be doing that. I never rounded inpatient because I think physician assistants were the only ones that could do that, and we had a team that was mixed with physician assistants and nurse practitioners. I was the only nurse practitioner. Physician assistants, they did inpatient. I did not. So I was more so on the clinic side. We also did what we call G-tube clinics. So there was a lot of patients, or a lot of the pediatric patients, who had G-tubes, and we had to teach the parents how to manage them, teach the parents how to troubleshoot the G-tube, if they had any infections or something that was going on with the G-tube hub. We absolutely had to, one, step in for that, prescribe medications for it, and if they needed another surgery or something of that nature, we would recommend that to the surgeons for proper care moving forward. I also was in charge of the thoracic side of that, which is, well, esophageal. So the two surgeons that I worked with, they were the only two surgeons that knew how to do a certain pediatric surgery for what we call achalasia. Achalasia is an esophageal condition that is very rare and is often underdiagnosed. And so we were the only pediatric hospital that knew how to do what is called a POEM, which was used in diagnosing patients with achalasia. We accepted a lot of patients from all over the world, even outside of the United States. So we had patients from Jerusalem, patients from Australia, patients from Dubai, all of those kinds of things. You're probably wondering, like, where are y'all seeing these patients? I launched the telehealth portion of that. So we curated doing protected visits that were online, where we could talk to patients and their families overseas or out of the country and let them know, okay, this is the surgery that we think needs to be done. You know, this is how we get you here. These are going to be the costs, all of those things. And we had a global department that also worked with these patients and their insurance to get coverage, how much they would have to pay out of pocket, coordinating their inpatient stay, their post-op visit before they left, and then what was to come next. So that was my job, on top of doing clinic and those kinds of things. So even though I wasn't rounding inpatient, I had another aspect to my job, which I loved because I was able to meet a lot of people. I got a lot of experience with curating a telehealth portion of, you know, a department, something that they didn't have before, creating policies that we needed to be, you know, up to date on as far as keeping the patient safe, keeping us safe. So it was definitely an experience. However, after I had my son, I had to quickly transition because you see a lot of things in pediatrics that you just don't want to take home. I think the moms who continue to work in pediatrics after having children are so brave and so strong, because I literally just could not do it with having a child. It was a lot of things to kind of take in. What I will say is that children are so resilient. It was such a loving place to work, but I just couldn't, get past the fact that I just had a baby. I see babies kind of going through certain things like cancer and all that stuff, which I couldn't do it. So after maternity leave, I transitioned to pre-anesthesia testing at another company. You might be wondering, well, what is pre-anesthesia testing? What do nurse practitioners do there? Happy that you asked. So this was just mainly a pre-op assessment, like physical head-to-toe assessment for when patients are getting ready to go to surgery. So we had to review labs, medical history, medications, make sure that if they were taking any medications that they needed to stop, they knew what those were, or consulting with their doctor about when to hold those medications, when they should continue after surgery. If they needed an EKG, we did those. if we needed to consult with other specialties, maybe like they were followed by pulmonology or vascular, to let them know, hey, they're going into surgery. Do they need anything clearance from you guys? Do they need to be in a hospital setting? We were basically the connection between the surgeons and anesthesia to say if this patient was safe to go into surgery or not. And if they weren't, one, what do we need to do as far as further workup? Or two, how long should they wait for the surgery that they need to get until they can be cleared? Of course, this was right up my alley because remember I said right before I became a nurse practitioner, I also worked in pre-op. And this is kind of what we did. Risk assessments and patient safety and things like that, making sure everything on the list is good to go. This patient is good to go so that we can send them into surgery. So it was a no-brainer for me. This kind of came easy because it's something that I've already done. This takes very honed in physical assessment skills. Don't want to miss anything. Of course, you have a lot of layers where anesthesia will be reviewing the chart too. We had like an anesthesia chat where we would send messages to anesthesia just to say, hey, you know, this is what's going on. For example, like patients who have sleep apnea, we used to have anesthesiologists come in and do an assessment of their airway just in case. Like, I don't know if this patient is okay, but can you come and do a second assessment? And they would gladly come and help us out. So this is just to make sure that at the bottom, patient comes out of surgery and they're alive because we need to get them back to their families. So this is strong assessment skills, strong risk assessment, and patient safety that needed to take place with this job. However, something I already done, so that was an easy transition for me. Now on to my current role, which is gastroenterology. I actually had a little bit of gastroenterology experience because of general surgery, and we worked with gastroenterology department a lot for some of their patients, G-tubes, abdominal things, etc. So we would kind of like send patients to gastroenterology, or they would send patients to us. It was just learning that little bit of knowledge. I was just like, okay, great. At my last job with the pre-anesthesia testing, I didn't want to commute anymore. I was taking a lot of time from home and from my child, and I really just wanted to find something remote. Get on LinkedIn, lo and behold, this, hospital system that I'm with now, they are launching a full telehealth program for gastroenterology. Knew that they're doing because they wanted to get patient access. It's really hard for patients to get access to specialty departments. Sometimes it can take them months, anywhere from 3 to 4 months to be seeing someone. Gastroenterology wanted to cut that time in half. Actually, we can see patients within 48 to 72 hours of them getting a referral. And so this is strictly virtual, and we see a lot of patients. Majority of the patients that I see are colon cancer screening consults. So this is patients who need a consultation to talk about colonoscopy, how to prepare, getting them scheduled, etc. We also see a lot of constipation patients, diarrhea, urgent care follow-ups. Maybe they had a GI issue at urgent care. Of course, they would send them to a specialty, so we follow up on those. We see patients who are coming in with elevated liver enzymes or fatty liver, maybe abdominal pain, gassiness, bloating, a whole lot of things. So these are, diagnoses that I feel are very safe to see virtually because we can always send them in person so that they can follow, for long term if they need to do that. So we are just the initial nurse practitioners who will see these patients. We order labs, we can order imaging, we can get them set up for a colonoscopy or upper endoscopy if necessary. Then if they need to follow up for future long term, then they can do that in office. So that's typically, what we do on a daily basis. And again, I work from home, it's strictly virtual, and I feel like I work real hard to get here, honey. One thing that I really enjoy though about gastroenterology is just learning about the inner workings of the GI system, which in turn has helped me to better my GI system and want to take my gut health a little bit serious, especially as a woman in her mid-30s when hormones, are all up and down. Of course, I've shared with you guys before that I have ADHD, and I think a lot of people don't understand that some of the things that we experience are internal acne can be internal, what you eat, what you put in your body, just a lot of things. And so I have made it my charge and my business to kind of educate the masses on gut health and how some of these gastrointestinal things like acid reflux or bloating or SIBO and things like that kind of come about, and what the gut connection is to that. I typically do that on Fridays on Instagram, so you can check that out. So a question I always get is, how did you break into specialty positions as a family nurse practitioner? The first thing I will say is that you have to be open to learning. Specialties require a lot of on-the-job training. I think surgeons, if you work with surgeon or any in a specialty, want to see that you are open to learn, you're open to change and adapting. So they want to see that you can learn and grow. So you always have to be kind of on your toes, doing professional development, going to conferences, going to meetings. We used to have grand rounds for general surgery. For gastroenterology, we literally have a meeting once a week about a specified topic that our nurse practitioners have asked to be talked about. So we do a lot of ongoing learning, and that's not something that let me just say this. If you're in healthcare and you don't like to do ongoing learning, I'm not sure you're in the right place, boo. The second thing I will share with you guys is building relationships is very important when you are breaking into a specialty. Most specialties work with a number of other either specialties or doctors, etc., just to get their patient what they need to get. For example, I am primarily in gastroenterology. However, a lot of primary care physicians or nurse practitioners send their patients to me for a number of things, whether that is patient having changes in bowel habits, it's their screening time for colonoscopy, maybe they think they need an upper endoscopy, maybe anemia. And so we work with primary care doctors and nurse practitioners very closely. We also work with hematology. Maybe our patients are having anemia and we scope them and there are no bleeding issues in the GI tract. So we refer them to hematology to see what they think. We also work very closely with genetics to try to figure out, if it's a colon cancer or esophageal cancer or other types of diseases or things that may run in the family for the patient. We refer them to genetics because we want to figure out when they need to be screened, what they need to do. So you have to be open, willing, and have the confidence to reach out to these doctors, refer these patients out, have the knowledge to refer them where they would go to, all of those things. So building relationships and specialties are very important. The last thing I want to leave you guys with is to be willing to just venture off from the traditional path. Again, just because you did the family nurse practitioner route does not mean you have to do primary care. And I'm not being shady to primary care at all. If that is what you want to do, absolutely do it. It's just not for me. I know a lot of nurse practitioners who are family nurse practitioners and work in women's health, urgent care, ED, orthopedics, cardiology, whatever it is. So if those are things that you want to do, please understand that those opportunities do exist. Please don't let anybody tell you that they do not. Also, when you get in interviews, you absolutely want to talk about your ability to learn well, learn fast, that you can grow, hone in on your skills, that you can adapt to change, all of those things, because I feel like when you're working in specialties, that is exactly what they want to see. They want to see the potential for you to be able to go very far, right? They want to see the longevity in the nurse practitioner that they're going to hire. So definitely want to make sure that your resume is in tip-top shape to also just show that that is what you have done over your nurse practitioner career or in your nursing career, because maybe this might be your first specialty job. It might be your first job as a nurse practitioner. It does not mean that you cannot get into a specialty. So I really want to drill that into you guys' heads, because I think sometimes when we think about specialties and people always talk about how hard it is to get in and stuff like that, we kind of just talk down to ourselves and say this cannot be done. But it can be done, and you will do it. So if you're a new nurse practitioner or a nurse practitioner student, my advice to you and what I want you to take away from this video is that your career path don't have to look like nobody else's. It does not have to look like which people have painted it to be. Make your own path. I always suggest to people to think about their goals. What is your first year goal? What is your 3-year goal? What is your 5-year goal? What does that look like for you? Where do you see yourself? Where do you want to work? Where do you want to make an impact or a difference? Right? And then look at your resume and look at all the places that you've been when you did your clinicals. Where is the one place that you thrived? Do you think that you can have longevity in that specialty? If so, give it a shot. Don't feel like you have to put yourself in some box. Take every opportunity, and maybe you'll get into a specialty that you thought that you liked and you didn't. These are resume builders. I need for y'all to understand that. If you don't like a job that you're in, but you learned something, put it on your resume. Like, use every opportunity that you can to build yourself up for the next position that you'll get. So always be open to exploring what you think will work best for you, where you feel like your career will go. And also, your career is always changing, and it'll change as much as you grow as a person. So what you liked 3 years ago might not be where you want to go 3 years from now. So a lot of self-reflection in that, but take your time, figure it out, and then go forth. As always, if you're a nurse practitioner, NP student, or nurse, I would love to know what specialty you want to work in, or if you're currently a nurse practitioner, what specialty you're currently working in, and how did you get in that? And you can add any tips in the comments that you want that will help others, because like I said, we have to stick together. If you love the nursing content, I definitely want to see you as a subscriber. We share a lot over here. Life as a nurse practitioner, mom life, a fashion baddie, okay? Gut health, fragrances, all of the things. So like, subscribe, share with anybody you feel who would benefit from this video. Thank you guys for watching. Bye.